My name is Dr. Marianne Essam, and I'm a GP, and I work in Hertfordshire in South Oxley. I've been a GP for nearly 30 years. And my other title is Clinical Lead for Social Prescribing. To explain social prescribing, I need to get you to put your wide-angle lens on for a moment. We are all much more than our clinical history. And in fact, our health and our well-being depends on much more than that. It depends on a lot of things that make us secure and happy and connected and belonging and significant. Depends on our education, our family, our relationships, our finance, our housing, the sanitation, our nutrition, lots of different things, our employment, or if we're disabled, how we are enabled. And what social prescribing does is it takes a wider angle lens than the clinical view. It doesn't just look at what's your blood pressure, what's your pulse, what's your temperature, what are your blood tests, what's your x-ray result, your clinical history of your clinical symptoms. And your GP might be the only person you go to. Only you might well not admit what's really going on. You might well present just with your depression and anxiety and seek medication and traditional counselling. You might just present with your chronic obstructive airways disease and not let on how cold and derelict your house is. You might just present with poorly controlled diabetes and not present with the financial issues that mean you can't afford healthy food and you're living on the wrong kind of nutrition entirely. So social prescribing gives us an opportunity to signpost individuals into that broader, trusting, safe conversation, which enables them to start to expose and explore the other things that are preventing them being whole.
We can focus on the individual and find a person-centred solution to whatever their problems are. We're not limited by statutory restraints. We don't have a budget to work with. We have to find other people who can provide the services. And what we're doing is we're trying to join up the dots. You know, a doctor only has 10, 15 minutes to talk to somebody, so they can't find out that the little old lady who keeps coming in with pneumonia or chest infections, he isn't able to find out, like we are when we go and visit her at home, is that she's got three window panes missing in the bedroom, and that's why she's always cold. Even when she goes to bed, she's still cold, and that her boiler broke down 2 years ago and she hasn't had the money to replace it. So we can contact her landlord, we can get a grant for a new boiler, so we can make her home environment warm and safe. You know, if there's a trip hazard in the house with worn carpets and things, we can get that sorted out by applying to other agencies, other charities. We can get grab rails put in so that she's not going to fall. We can join up the dots and get all those different agencies involved to solve the problem of her either falling at home and going to the doctor because she's got these swellings on her legs, sores that aren't healing, or because she's continually getting chest infections. She's therefore not going to the doctors as often. She's not as depressed because she's, not well constantly. And so we can get all those different agencies involved because we have the time. There aren't statutory limitations to what we do. We network like crazy. And we can find a tailored solution to a problem.
Now, people can either refer themselves in through an organisation called Hearts Help, who are the central point of information and advice. More often than not, people are also referred through a professional that might be working with them. That might be a GP or a practice nurse, it might be their social worker, it might be somebody from a voluntary organisation who already knows them but actually doesn't know where else they can source some help and support for them.
But having a community navigator rather than simply a website or a phone number makes that kind of help accessible to people that would not otherwise have been able to go there. Of course, the website, the phone number is always going to be useful, and Hearts Help should be on everybody's desktops, walls, handouts, etc. And we need the community to be steeped in that as a place to go to for solutions, libraries, chemists, shops, etc. That needs to be known, that needs to be on everybody's lips. Schools, neighbours, everybody needs to know that actually if we're stuck, let's try Hearts Help, because they've got a database of 1,000+ community agencies and individuals who may be the missing link for a person.